Imagine waking up every single night because of a burning sensation in your feet, not from heat, not from injury, just your own nerves misfiring signals your brain cannot ignore. You visit a doctor and they hand you a prescription. Sometimes it says Pregabalin. Sometimes it says Duloxetine. And sometimes you are left wondering, what is actually the difference? And which one is actually going to help me? That one question is exactly what we are answering today. Because if you or someone you love is dealing with nerve pain, understanding these two medicines is not just helpful, it is important. Before we compare the medicines, let us be clear about what nerve pain actually is, because it is not like regular pain. When you twist your ankle or cut your finger, that pain has a clear cause, and it goes away with rest. Nerve pain is completely different. It feels like burning under the skin, constant tingling, or sudden electric shock sensations that come without any warning. People often describe it as pain that has no off switch. This type of pain is usually linked to conditions like diabetic neuropathy, a herniated disc pressing on a nerve damage after an injury, or even post-surgical complications. The frustrating reality is that from the outside, nothing looks wrong, but inside, the nerves are constantly sending wrong, amplified signals to the brain, signals that say danger when there is none. This is exactly why regular painkillers like paracetamol or ibuprofen barely help. Because the problem is not inflammation or tissue damage, the problem is the nervous system itself misbehaving. That is where Pregabalin and Duloxetine come in, but they solve this problem in very different ways. Let us start with Pregabalin. Pregabalin works directly on the nervous system. Think of it like a volume dial for your nerves. When nerve damage happens, the affected nerves start shouting, sending far too many pain signals to the brain. Pregabalin turns that volume down. It does this by blocking certain calcium channels in the nerve cells, which reduces the amount of pain signals being released. The result? Many patients feel a noticeable difference relatively early after starting the medicine. This makes Pregabalin particularly useful when someone is dealing with sharp, intense, or sudden nerve pain that needs to be brought under control quickly. However, this fast action comes with a cost. Because Pregabalin acts on the nervous system broadly, it can also cause significant side effects. The most common ones are daytime sleepiness, dizziness, difficulty concentrating, and that heavy, foggy feeling in the head. Some people also experience weight gain with long-term use. One more important thing to understand: Pregabalin does not repair the damaged nerve. It simply reduces the excessive noise those nerves are generating. So when you stop the medicine, the pain can return, because the underlying nerve issue has not been fixed, just quieted. Now let us look at Duloxetine, and this is where things get genuinely interesting. Duloxetine works in a completely different place. Instead of acting on the nerves directly, it works inside the brain. It belongs to a class of medicines called SNRIs, serotonin norepinephrine reuptake inhibitors. What this means in simple terms is that it increases the availability of two key chemical messengers in the brain, serotonin and norepinephrine. These chemicals play a central role in how the brain processes and controls pain signals coming from the body. When these chemicals are at healthy levels, the brain becomes more efficient at filtering or dampening incoming pain signals before they are fully perceived. It is like upgrading the brain's own internal pain management system. Because Duloxetine works through this slower chemical balancing process, it does not give fast relief. It typically takes several weeks before a patient notices a meaningful difference. But the benefit it offers is often more stable and sustained over time. There is also an additional advantage that many people do not expect. Duloxetine can improve mood and reduce anxiety. This matters more than it sounds. Long-term nerve pain is mentally exhausting. Many people who have lived with chronic pain for months or years develop depression or anxiety alongside their physical symptoms. Duloxetine addresses both the pain and the emotional burden that comes with it. Now that we understand how each medicine works, let us put them side by side clearly. Speed of action: Pregabalin works faster. Many patients notice relief within days to a couple of weeks. Duloxetine is slower. Meaningful improvement usually takes 4 to 6 weeks. Type of pain they suit best: Pregabalin is better for sharp, shooting, or highly active nerve pain that needs rapid calming. Duloxetine is better for chronic, ongoing nerve pain, especially when it is accompanied by low mood, anxiety, or fatigue. Side effect profile: Pregabalin tends to cause more sedation, dizziness, and fogginess. Duloxetine can cause nausea, especially early on, dry mouth, mild sleep disturbances, and, in some cases, increased sweating. Long-term use: Duloxetine is often considered more suitable for long-term management because it addresses both the pain pathway in the brain and the emotional response to chronic pain. Pregabalin, while effective, carries concerns about dependence and withdrawal if stopped suddenly after long-term use. Additional benefits: Duloxetine also helps with depression and anxiety. Pregabalin has a mild anti-anxiety effect, but is not typically prescribed for mood-related symptoms in isolation. Here is the honest answer, and it might surprise you. Neither one is universally better. The right medicine depends entirely on the patient. A doctor choosing between these two is not picking the stronger option. They are matching the medicine's mechanism to the patient's specific situation. If someone has acute, intense nerve pain that is disrupting their sleep and daily life, Pregabalin may be the first choice to bring things under control quickly. If someone has been dealing with nerve pain for months, is also struggling emotionally, or needs a long-term solution they can maintain, Duloxetine is often the better fit. And in some cases, doctors use both at different stages of treatment. A patient may start on Pregabalin for quick relief, and as things stabilize, transition to Duloxetine for long-term management. This is not unusual. It reflects how personalized nerve pain treatment really is. Here is something that rarely gets explained clearly. Nerve pain treatment is not a one-time decision. It is an evolving process. Your nervous system changes over time, with healing, with age, with lifestyle changes. What works at the beginning of treatment may not be the best choice 6 months later, and what feels like a failure with one medicine does not mean the next one will not work. Two people with the exact same diagnosis, say diabetic neuropathy, can have completely opposite responses to the same drug. One person takes Pregabalin and finally sleeps through the night. Another takes the same dose and feels so drowsy they cannot function. This biological individuality is why there is no shortcut and no guaranteed formula. The best approach is always an honest conversation with your doctor, sharing exactly what you are experiencing, what side effects you can tolerate, and what your daily life looks like. That information is what guides the right choice, not just the name of the condition on a prescription pad. So let us bring it all together. Pregabalin and Duloxetine are both real, effective options for nerve pain, but they are built for different jobs. Pregabalin quiets overactive nerves quickly. Duloxetine rebuilds how your brain manages pain over time. One is faster, the other is steadier. Neither is perfect for everyone. The most important shift in thinking is this. Instead of asking, which medicine is stronger, ask, which medicine fits my situation better? That is the question your doctor is actually trying to answer when they write that prescription. If you are currently dealing with nerve pain or supporting someone who is, I hope this gave you clarity that most people never get. Understanding your treatment is the first step toward making it work for you.